Now, time to talk about Etoricoxib. Etoricoxib has a dose in different tablets. There are different amount present. You can find Etoricoxib as 30 mg tablet, 30, 60, 90, and even max of 120 mg. So these are the four formats for dosage in which Etoricoxib you can find in the pharmacy. Right, now how to give this dosage? You can give a max dose of 120 mg. 120 mg. It has to be the max dose. Right, it means that if you're using 30 mg tablet, you can give 4 times. 60 mg you can give 2 times. 90 mg probably 1 times, and 120 mg 1 times. 90 mg tablet you can use it for some other purpose, but 30, 60 and 120, these are the standard one. Right, now talking about the onset time. Onset of Etoricoxib is similar to other NSAIDs from 30 to 60 minutes. It will start its function. It will be in its peak in 1 to 3 hours. And overall duration of action of Etoricoxib is somewhere about 18 to 24 hours. This is the main thing to remember, because Selective was having a much greater duration of action than the Etoricoxib. Now, we just said that this is the max dose, 120 mg. So if we go beyond 120 mg, there will be a greater risk of GI bleed. So GI bleed risk will be more than 120 mg. Okay. And lastly, the indication when to give somebody Etoricoxib. For that, let's first check our table. So we are here, Etoricoxib. Etoricoxib is completely similar to that of Selective in almost everything. It has a moderate analgesic effect, almost mild antibiotic effect, high anti-inflammatory effect, and still has the least GI bleeding possibility or the GI bleeding risk. However, they also have the similar effect, that is it can cause increased risk of thrombus formation. It can cause MI, stroke, and they can be even high risk of hypertension. Also, both of them can also affect your renal system as well. Right, so whenever we prescribe somebody Selective or Etoricoxib, please check their cardiovascular health. Right, and because it has a good anti-inflammatory effect, however not the best, because the best anti-inflammatory effect was of piroxicam, right? However, the piroxicam was having a very high risk of GI bleed. Now for Etoricoxib, we can give Etoricoxib in some conditions that is similar to that of Selective: arthritis, acute pain, dysmenorrhea, and so on. Right, so indication of Etoricoxib: arthritis, all the chronic inflammation condition without fever, gout, and post-operative pain. Right, you can also use it for dysmenorrhea. Right, so there are a list of all these things in which we can use Etoricoxib. Now, what is the combinations of Etoricoxib available? Now, because Etoricoxib lack few features, so we combine Etoricoxib with those to complete the combination so that it will help the patient in all the aspect. First combination, Etoricoxib plus paracetamol, okay, to cure the fever and other stuff. Also it will help patient to recover from pain as well. Second is Etoricoxib plus thiocolchicoside, again for musculoskeletal pain along with spasm. Very good combination for cervical spondylosis. Third combination can be Etoricoxib with ceratopeptidase. Ceratopeptidase is a very good drug for like whenever there is a like post-trauma inflammation, you can use ceratopeptidase. Also for this combination, ceratopeptidase is actually again helpful because it decreases, when we add the ceratopeptidase, we decrease the Etoricoxib combination, right? And overall the risk of some other side effects also goes down. And lastly, you can use ceratopeptidase with not ceratopeptidase, the Etoricoxib with tramadol. Tramadol is very good for, it's a very good like for painkiller, right? So because Etoricoxib was having less potency for analgesic effect, so we give tramadol alongside with it to complete the combination. See, Etoricoxib has less, this also has less, so we add tramadol with Etoricoxib to make a better combination pill. So this was about the Etoricoxib, and lastly that we are left with is the PPI. Though risk is again the least, the Celecoxib and Etoricoxib has the least side effect for the GI bleed, right? But still, if somehow we need to put a patient on more than 120 mg per day, so there's 120 mg per day. If we need to go beyond this limit, we can add a PPI with it. Now the PPI for Etoricoxib is pantoprazole, again once a day, and you can give pantoprazole like 20 mg format. So Etoricoxib must be given with pantoprazole. Again, we have already discussed in previous lectures how to choose a PPI. I'll not discuss it again, right? So this was all about Etoricoxib.